Good morning, everyone. My name is Ryan Wycliffe. I'll be giving the radiology intern lecture on chest, and thank you, everyone, for your flexibility. I was actually in the middle of moving this week. This morning, our moving truck came, and tomorrow morning, kind of unexpectedly, our car transportation is coming in the morning, and so I wanted to at least record this as much as I could. The night before, so that way you guys could have it and watch it at your leisure. I apologize for not being able to do it at that exact time, but I hope you find some benefit with this, and at least with some of the advice I'll give regarding studying materials. I do apologize if I sound a little tired or a little under the weather. We've just been trying to get through this week as far as moving and everything like that. So I appreciate your understanding. Basically, I'm just going to go through some information here that I made a PowerPoint presentation on. I was having a little trouble trying to get the PowerPoint synced with audio correctly, so I just did it through the Adobe app, and hopefully this will come out clearly for you guys. But basically, there's some general tips I wanted to give you over chest radiology. Is first of all, overall, one thing I found most helpful was just making slideshows of screenshots from interesting cases and examples along the way. And this can be anything from rad primer, maybe you're watching a lecture online. Regardless of what it is, if you see something that is interesting, or let's say it's a radiology assistant, you can take a screenshot of it, just throw it into a PowerPoint, and that helped me the most. Radiology is really image rich, and there's a lot of textbooks out there, and they're great. But for me, when I was reading the textbooks, the images were really the things that stood out to me the most and helped me remember pathology the most and everything. And so I'd really recommend, if I were to start things over again, just trying to create a section, let's say this for chest. Whenever you watch chest lectures, or you're doing chest, or you're doing rad primer questions, if you see some interesting case, for me, what helped me the most is just taking a screenshot of it, throwing it into a PowerPoint presentation, or reviewing those high yield things repeatedly, and that kind of stuff really helped solidify that information and build a strong foundation. But some of the websites that I really found helpful, and a lot of people will say these same things, are Radiology Assistant. It does seem a little basic at first, but the information is really critical and crucial for important findings, not only for working, but also for your tests. And so I'd really strongly recommend that website. In fact, I used a lot of the information here from this PowerPoint presentation from that website alone. So you guys can kind of take a look at it and see. And eAnatomy is great, especially for anatomy. StatDX is wonderful, especially for understanding diagnoses and things like that. And they have a lot of examples there. So I really like StatDX. Radiopedia is great too, and I didn't put that up here, but Radiopedia is really good. It's just usually a little more basic, but if you're trying to do something kind of quick, a lot of times it's a really good go-to if you don't have time to log into StatDX or something like that. StatDX just generally has a lot more examples and a lot more information. For chest specifically, Dr. Messer's lectures are amazing. I found his lectures to be the most informative, and for me, the most helpful lectures out of anyone at UAMS. And the fact that he teaches chest really well was really helpful for me. And also his board reviews are great for chest. And there are a few cardiac things that were on your guys' website that you're supposed to review. So I'd really recommend Dr. Jambakar's board review as well too. They'll do these in several years, but basically, if you guys have a Dr. Messer lecture, I'd really recommend attending it. They're just very interactive, and the way that he taught was a way that I really learned a lot. So I'd really strongly recommend those. The Society of Thoracic Radiology is a really great website. It's a free website, and they have lectures under the education portion here. And part of that is called the Resident Boot Camp, and they have other lectures, and they're free, and they're short, and they're really helpful. And I really strongly recommend those as well. There's something called Rad Discord, and basically this is really great, especially for board preparation, but it may be a little bit too advanced when you're first starting off as an R1, but especially as you start getting in through more of your R1 year, and especially as your R2 year starts, it might be something that'd be really helpful. Seeing those cases and hearing people talk about them, even if it's pretty advanced, is a good tool, to kind of start getting used to this type of stuff. Rad Primer is great. It's your Q bank. I'd really strongly recommend that, especially the basic section, at least just to start off. It really kind of helps to understand how questions go, and they have some really good examples and explanations. And spend your time on it. It's better to kind of go through that slowly. It's a really big question bank, and so the earlier you can start, and trying to have goals of doing a certain amount of questions per month or per week, in a certain section that you're on, or maybe if you're on a certain rotation, just doing those questions by the end of the rotation are really good things to do. When you get to boards, there's different resources out there, and you'll hear all about this stuff, but things like Crack the Core, Board Vitals, Core Review Series, and the Duke Review, all are really great resources. And so just wanted to give you guys some general tips. In my opinion, this is the most important information I can give you the entire lecture. As far as going through anything that you guys are going to remember in a few years over this lecture, there's probably not going to be too much, but if I can point you towards the resources that will help you, along the way to build those resources, I think that's probably the most helpful thing I can give you, or anyone can give you at this point. And I did go through that website that you guys are supposed to be looking through, and it did have some helpful information. So I did include some of that in this presentation. And just a quick review, there are 3 planes of imaging. There's the axial plane, sagittal, and coronal. I'm going to fly through some of this information fairly quickly, and so I will send these slides out to you guys, so feel free to review those. And that's another thing too, for me, I found a lot of times, even if a lecture, I was having a hard time paying attention, or if it was going too fast, if I could at least just look at the slides, sometimes I could learn a lot more that way, and I could review it as well afterwards. And so, whenever you have an opportunity to get the slides from somebody, or, if you're reviewing something, just try to at least look at the slides, even if you don't have too much time to listen to the lecture. But when you're looking at the axial or transverse plane, it's viewed from below as looking towards the head. And so essentially, this is viewed from below. This is the patient's right side. This is the patient's left side, posterior and interior, and they're laying supine in the scanner. And a sagittal plane over here, you're looking at a patient from the left side. Coronal plane is a frontal view, looking at the patient from the front. And here's some anatomy: aortic arch, main pulmonary artery, left ventricle, and diaphragm. And here we have an axial view of the aortic arch. And so here's the aortic arch, and here's your little thymus, and here is your SVC, your trachea, and posterior to that is your esophagus. And basically, this is your general axial view of your aortic arch. If we were to go just a little bit more superior to that, you can notice your great vessels, and it might be a little hard to make out on the screen here, but here's your right brachiocephalic vein, your left brachiocephalic vein, your brachiocephalic artery, left common carotid, and then your left subclavian. Here's your AP window: ascending aorta, descending aorta, esophagus, trachea. And this is a really great slide, I thought. This is actually from Radiology Assistant, so I'd really strongly recommend taking a look at that website. But essentially, what this is talking about is this having a systematic approach. So whenever you review an x-ray, develop a systematic approach. They use an inside-out approach, which is really common, starting in the central area and then going more peripherally. The heart figure is evaluated, then the mediastinum, and then the hilums, and then the lungs, and then finally the chest wall and the abdomen are examined. And so, it's important to know your normal anatomy and your variance. Here's your aortic knob, pulmonary trunk, left atrial appendage, periaortic line, left ventricle, a paraspinal line, azygoesophageal recess, your right atrium, your interlobar artery, and then your right paratracheal stripe. For the heart and pericardium, this is also from Radiology Assistant. On a chest film, it's usually you're only usually able to tell if the heart is normal or enlarged, but it is important to be able to point out a few structures. And so the left atrium over here is your most posterior structure. Your right atrium, basically, if you ever have enlargement of that, which is over here, you'll have an outpouching of this right heart contour. The left ventricle is over here, and if you have an enlargement, it's going to cause an increase of the heart size to the left. And then your right ventricle is the most interior structure, and it's behind the sternum. And if basically, when you take a look at the sagittal view, the right ventricle is most easily seen here, more interior, and then you have your left atrium, which is more posterior. This is the view of the two-chamber heart showing both your right and your left ventricle. This is the coronary sinus here. It runs along the